Hi, this is Lauren Maldonado. This is for Nurse 5220 Health Assessment Lab. This is my ID. This is my blank sheet of paper. This is my equipment under the computer. This is my scan of the room. This is where I'll be sitting. That's my blank sheet of paper. Okay. Okay, this is my husband, Chris Maldonado. Do you give your consent to be videotaped? Yes. Okay. All right, walk into the room, knock, 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 hand hygiene. Hi, I'm Lauren. I'm your nurse practitioner today. Can you give me your name and birthday? Sure, it's Chris Maldonado. Birthday is September 11th, 1972. Okay. Do you feel okay to answer questions today? Yes. There's a lot. Okay, so it looks like you came in for your annual physical exam. Yes. Okay. Well, let's start off by what medications you're taking. Currently, I take 40 milligrams of lisinopril. Okay, at night? At night, yes. Okay, are you taking it for high blood pressure? Yes. Do you have any other health history other than high blood pressure, heart disease, thyroid disease, cancer history, diabetes? No. Okay. Um, have you had any recent hospitalizations? No. Any illnesses or injuries like motor vehicle accidents or things like that? No. Okay. Are you up to date on your immunizations, Tdap, MMR, hepatitis B? Yes. Okay. When was your last physical exam? It was about a year ago. A year ago? Yeah. Okay. I noticed you're over 50 years old. Have you had your colonoscopy yet? No, but I do have one scheduled in the next couple of weeks. Okay, sounds good. I want to ask you a little bit about your family history. It's grandparents, parents, siblings, and children. Okay. Okay, are your grandparents on both sides alive or deceased? They're all deceased. Do you know the cause of death for any of them? No. One actually, my the grandmother on my mother's side, I believe she had Alzheimer's. Alzheimer's, okay. Any other health history for your family? Diabetes, high blood pressure, heart disease, cancer, irritable bowel? No, with them aware. Okay. How about parents alive or deceased? Deceased. Deceased, okay. How old were they when they deceased? My mom was like 75. My dad was like 70. Okay. Do you know the cause of death for either one? My dad, no. My mother, she had a fall. Okay. And then are your siblings alive or deceased? They're alive. Are they all in good health? Yes. Okay. And then your daughter, you said, I'm sorry, can you tell me your living situation? Yes, I live at home with my wife and daughter. Okay. How old is your daughter? She's 23. Okay. And then does she have any health history? Yes, she has autism. Autism. Okay. Thank you. Um, okay. Do you have any history as far as like anxiety, depression, or mood disorders? No. Okay, and then you already gave me your name and birthday. I want to ask a few questions I ask all my patients. Can you tell me where you are? Yes, by your office. And can you tell me the day today? Yes, it's Wednesday, April. I don't know the exact date, the number. It's 2026. Okay, thank you. Okay, and then Chris appears to be in. I'm trying to look at the camera. Um, well nourished, calm and cooperative. Uh, he's alert and oriented. Times four. Um, okay, I'm gonna ask some questions about all of your body symptoms just to get an idea of what's going on or if there is anything going on. Okay. Have you had any recent fever, chills, or weakness? No. Okay. Any shortness of breath, cough, or wheezing? No. Okay. Any palpitations, chest pain, or swelling in your legs? No. Okay. Any shortness, or I already asked you that. Any nausea, vomiting, diarrhea, constipation? No. Can you tell me your last bowel movement? Was this morning. Okay. Was it regular, soft? Yes, regular. Uh-huh. And then what color? Brown. Okay. Have you had any burning with urination? Frequently urinating at night, hesitancy starting urination? No. And then any numbness, tingling, fainting, no. Dizziness, no. Easy bruising, no. Excessive thirst or hunger, no. Any excessive tiredness? No. Okay. Any changes in your mood, recent depression or anxiety feelings? No. No. Okay. Um, Sounds good. Okay. So I noticed that Chris's skin, I'm looking at the microphone. This is a camera. Um, I noticed that Chris's skin is um appropriate for ethnicity. He's not diaphoretic or anything. Um, I'll start the physical exam. Okay. Chris's skin is warm, supple, even. I should have asked you, do you have any rashes, lesions, wounds? No. No? Okay. Okay. And then I would inspect Chris's nails on both sides, and I can see that they're pink. And sorry, his capillary refill is brisk. His nail beds do not show clubbing. The angle is 160 degrees. And then I ask you if you could take off your hat so that I could take a look at your scalp. Sure. Okay, I would like systematically look at Chris's scalp, and I'm noting any infestations, which he has none. I would go around to the back as well and systematically look. For the purposes of the video, we'll make it quick. I went around the back. I looked. There's no lesions, infestations, or anything. And then I would feel his scalp, no masses, no tenderness. And then I could note the condition of his hair is just normal condition, and it's soft. Okay. I'll put the camera up more so you can see me talking. Sit up. Okay. All right. Okay, so I'd go on to head, ears, eyes, nose, and throat. Um, So I can see that Chris's head is normocephalic. It's symmetrical. Um, his and then I would look at his eyes. I would say that his pupils are normal size. They're like 2 to 3 millimeters. His sclera is white. His conjunctivae, if I could like, can you look up? I would look like that. They're pink, they're moist. His there's no discharge, drainage, redness going on. And then I would take my ophthalmoscope. Where'd it go? Okay. And I would look in Chris's eyes, eye to eye, and I would take my glasses off. This is already adjusted for my eye. I would turn on the ophthalmoscope. Oops, it's already on. And then my eye, I'd have you look at me, and then eye to eye, I would be observing for the red reflex. And then I would go in slowly and have Chris just look at me and fundal optical disc is present. He's retina is pink. He has all the blood vessels are intact. Then I would go to this side of this eye and I do the same thing and go in, and not that they're symmetrical. Um, the light has been shined in Chris's eyes multiple times today, so that is why the light is off right now. I have looked at his eyes. Um, okay, and then I would use the pin light, and then I would take it like this. Just can you look at me? I'm gonna do your pupils, so shine the light in your eyes. You're closing your eyes. Shine your in the eyes, and then can you look at my pin? And then just follow it. Okay, thank you. And then can you watch my pin? I'm gonna have you follow the pin. I'm doing the 6 cardinal fields of gaze. Okay. Have you had any blurriness with your vision, ear pain, nasal drainage, sore throat? No. Okay. Okay. And then I would say that he has perla, so pupils equal round and reactive, like and he has proper accommodation when he follows the pin. Um, and then I would use the I would inspect his ears, um, and I would say that they are, like equal on his head. They're in the proper position. There's no lesions, masses, wounds, none of that, no drainage. And then palpate, okay, and palpate the mastoid process, no pain here. And then using my otoscope, I would turn it on. This I'm turning on. Make sure. Can you turn your head towards the camera, like where the camera can see your ear? I think so. And then up and back for an adult, and I would brace my otoscope so that for safety, and then gently go into his ear. There's just some hair in his ear canal, no wax, no foreign bodies, no anything. And then his tympanic membrane is pink and there's no bulging or infections. And then the same technique on the other side. Um, I would brace with my pinky and go in and look. And he'd be the same on both sides. Yeah, I've looked at his ears. Okay. And then his hearing is grossly intact, but I'll do the whisper test. So I go behind him and say, like, okay, tell me what I say, please. Okay. And yes, that's right. And then Apple. Apple. So he passed the whisper test, and then I would take a look at his nose, and I can see that it is symmetrical. And then I'm just gonna like look at your up at your nares. His nares are pretty much even. I would use my otoscope and turn the light on, and then just look in your nose. Thank you. And it's pink. It's not. There's no congestion. There's no drainage or anything like that. And then I would look in his mouth. Can you open your mouth? And then just using the light here, I can see that He actually has no tonsils. I didn't ask you, do you have a surgical history? Any
No,
surgeries?
no,
No. Have you had your tonsils removed?
no.
Okay. Are you sure?
I think so. Maybe, I don't know.
Okay. All right. And then uvula, midline, no swelling, no redness in the back of his throat or anything. I would put on some gloves and palpate his inside of his mouth. I would be looking for like masses or ulcerations. I would get in his mouth and look at that. Can you open your mouth? Okay. And then I'll use the light. I could see his dentition is intact. His mouth is his oral mucous membranes are pink and moist and everything. Okay. Okay, close your mouth. Thank you. Okay. And then I would move on. Oh, you do have water. Okay. To his neck, and I'm inspecting his neck. I can see that it is symmetrical. His trachea is midline. He has no he has no masses or anything like that. Um, stethoscope. Okay. And then I'll just fill your neck. I'm gonna have my head so they can see me talking and where I'm looking. Um, okay. And then thyroid is not palpable. There's no like masses or anything like that. Um, and then I would go to around. Would you be able to stand up and then take a drink of water, like facing the camera? And then I put my fingers, yeah, like you swallow water and then like yeah, and like his thyroid is not palpable, so that is normal. And then I would auscultate and uh, using the bell of the microphone, I mean of the stethoscope. Um, let's see, I can auscultate over the thyroid, no bruise, and then um, I can palpate his carotid pulses one at a time, two plus, and then I would listen to his carotid. And there's no bruise or anything. Um, and there's no thrills or anything like that. I could just feel his pulse, two plus, one at a time. And then I would feel for his lymph nodes. Have you noticed any lymph node swelling or anything, pain, tenderness? Okay. And then I would feel, would you be able to turn your head or like your body to, or where the camera can see the back of your head? Thank you. I would palpate occipital nodes, and I'm comparing for size, symmetry, tenderness, mobility, and then like how soft they are, if they're palpable or if they're hard, the shape of them, if I can palpate them. And then can you turn to the side? I'm doing all this at the same time. I'm doing the posterior auricular behind his ears. If you could see that, yes. And then the pre-auricular, nothing. And then the anterior cervical on both sides. See, my other hand is over here. And then it's on the anterior side of the sternocleidomastoid, and then on the posterior cervical. And so there would be like the sternocleidomastoid triangle, and I don't feel anything. And then I have a mandibular right here under his jaw, and then submental under his chin. And then I would feel his tonsils, if I can feel his tonsils on both sides. Okay. And then I would have can you sit back down, please? Okay. And then okay, I would want to evaluate and feel his pulses. So I've already felt his carotid pulse. And then I could feel, can I have your wrist? Radial pulse is if they can see where I'm like palpating right there. And then brachial pulses are right here. And then if I can see. And then um, and posterior tibial. I'm gonna move the camera a little bit so they can see. And then can you take off your shoes, please? Thank you. And your socks. Because I'm gonna feel your pulses on your feet. Thank you. Okay. Posterior tibial, and then back here. Excuse me. Posterior tibial. This is popliteal, posterior tibial, and then dorsalis pedis on the top of his feet. 2 plus equal bilaterally. Okay, and then I noticed that he has no swelling. And then if he did, I would press my finger and look for the indentation. 1 plus 2 plus 3 plus 4 plus. Okay, and then I'm gonna adjust the camera again. Okay, and then okay, would you be able to remove your shirt and I'll do your chest, heart, lungs, and abdomen assessment. Okay, so I'm inspecting. I can see that Chris's chest is he is symmetrical. His nipples are in the mid-axillary line. He has no supernumerary nipples. His skin is intact and everything. No lesions or anything like that. Uh, and then I would palpate, and I could palpate his apical pulse, which would be at the fifth mid-axillary line, fifth intercostal space. Okay, and then I would also be looking for heaves or thrusts or bulges. Okay, and I would move on to my respiratory assessment. So my respiratory assessment, his respirations are even, unlabored. I don't hear any wheezing. He doesn't appear to be coughing or anything. Um, and then I would um, percuss. Um, so using my second finger and like a quick stripe on the distal interphalangeal joint, um, I would can you turn your back to the camera, please? I would percuss up until I heard resonance, and then mark the bottom level of the lung. Okay, and then I have an idea of like I'm trying to look at the camera. I'm gonna put it up more, like where I'm getting ready to listen. Um, okay, and then trying to show my face. Then okay. And then when I listen, I would listen with the diaphragm. And when you feel the stethoscope on your skin, can you take a deep breath? Mhm.
Can you kind of lean forward and cross your arms a little bit? And it moves the shoulder blades out of the way. And then, perfect. I hear no, they're clear to auscultation. I don't hear any wheezing or rails or anything back here. And then can you turn with your side to the camera, please? And then put your arms up. And then I would listen in three spots here. Deep breath. Thank you. It's clear. And then you can sit down. Thank you. I would do it on both sides for time purposes. We'll move on to the front. And then I would listen to the front of Chris's chest. Okay. Deep breath in and out. Okay. And then I could also percuss on the front mid axillary line. And I would be listening for resonance for the lung. Um, percuss in between the ribs, or else it will be false dullness. If I did in hear dullness or like hyper resonance, then I would know that there's like a mass or consolidation of some of some type, and I could do more diagnostic tests from there. Um, okay. And then I would listen to Chris's heart using first the diaphragm and then the bell. The diaphragm is for more high pitched, and the bell is for more low pitched. So high pitched would be more like friction rubs and things like that. The low pitch would be like S3, S4 gallops. Okay, and then okay, I'm gonna take a listen to your heart. I'll sit down. My back is breaking. Okay. And then listen, second intercostal space, right sternal border. That is the aortic. S2 greater than S1. I would listen. Can they see? Can you go kind of more? Thanks. That's perfect. Okay. And then second intercostal space, left sternal border, S2 greater than S1. This is pulmonic. Then right or left sternal border, third intercostal space. This is Erb's point, and it is equal S1 and S2. And then um, the tricuspid is in the fourth intercostal space. Left sternal border. S1 is greater than S2, and then the mid-clavicular line, that's what I'm trying to say, mid-clavicular line, not mid-axillary, mid-clavicular line, fifth intercostal space, that's the point of maximal impulse, and that is the mitral. Okay. And there were no rubs, clicks, or gallops that I noted. No murmurs. Um, and then I would listen with him sitting, lying, and then left lateral recumbent. And okay. Um, After that, I would move on to his abdominal assessment. Abdominal assessment is done laying down. Laying down. Okay. I can see that Chris's stomach. I'm gonna take the camera a little bit more away. I could see that Chris's stomach is his abdomen is like soft and round. There's no like pulsations, distended veins, ascites, none of that. His navel is midline. Okay. And all the while that I'm doing my assessment, I'm always assessing his skin. Um, and then I would before I do anything, I would auscultate, and then also I just for time purposes, that's why I'm only auscultating with the diaphragm, but on the heart and respiratory, I would do both. Listen first with the diaphragm and then the bell, and then the abdominal assessment's done laying down, but for these purposes, would you be able to show your abdomen to the camera? Oh, thank you. Okay, he would be laying down, but I would want to auscultate um all four quadrants, and they'd be active. I would have to listen 5 minutes in one spot. If to say that vowel sounds are absent, and then there should be between 5 and 30 gargles per minute to be considered normal active. Okay, and then I could also this I would use the bill for, and I could listen. Let's see for bruise and everything at the renal and iliac arteries, which would be like that, and then the aorta. I would listen, and it would be no bruise or anything like that. Um, and then um, this would be um laying down, but after I have finished my auscultation, then I would percuss, and I would percuss in all the abdomen, and he would be laying down though, so well, he had, tympani is what I should be hearing, and then I would percuss up. Can you turn that way a little bit? Thank you. And then maybe back up some because I think the camera has to see my face. Okay. But I would percuss up, um, and I would expect timpani. And then when I hit dullness on the right side, then I would know that that's his liver border. And then I would expect resonance as I'm going down. And when I hit dullness, then I know that's his liver border. I would use my measuring tape, and I would measure. And Chris's liver has already been measured. He has 6 centimeters, so it's between 6 and 12, which is normal. And then would you be able to lay down again, please? Um, I could use we're not gonna do it right now, but I would use the hook technique to go under the right side of Chris's or the inside of Chris's ribs right here, and I'm feeling for his liver and to see if it is enlarged or painful or anything. And then I would percuss up on the mid clavicular line and uh, left side, and expect to hear timpani all the way up until I hit his lungs, and then I would hear resonance. And if I heard anything on the left side, then I would know that that was a abnormal finding with his spleen. Okay, and then the last thing that I do with my GI assessment is my palpation, and so I'll take my hands like this, and I don't know if the camera can see. would you be able to stand up with your abdomen towards the camera? And then I would light palpation first. I would go around and palpate, and then as um, feeling for any masses or pain or anything like that. And then I could palpate his aorta to see how wide his aorta is. And then also, then I would do, I could do my deep palpation, which would, and observe for any guarding or like what his response is, and then any like organ enlargement or anything like that. Okay. Um, can you sit down again? Thank you. Okay. Um, actually, would you be able to take a few steps? Would you be able to take a few steps? I'm gonna observe your gait. Okay, and I need to be on the camera here. Thank, thank you. Okay, and then with your back to the camera, I'm trying to put my face to the too, so they can see me. I would have you to like bend over and to touch your like reach toward your toes. And then I would get behind him and look, and would be able to see that his spinal curvature is normal. There's no curves or anything like that. I observe him from the side, and there's no lordosis or kyphosis or anything like. Okay, and I can see that his gait is even. His balance is good. His coordination is good. Um, Okay. Would you be able to sit down again? Thank you. Okay. Okay. Um, and then, so we've already felt your lymph nodes. We've done respiratory, cardiac, GI. We can move on to neurological. Um, God. Cranial nerve number one is olfactory, it's sensory, deferred for this exam. You would test using like coffee or cinnamon or something, a well-known scent. Um, Cranial nerve number two. Oh, in our eye assessment, we also used our Snellen eye chart, which we have purchased from the bookstore. And was a normal. He stood at 20 feet and read all the way to the smallest line, indicating that he has 20/20 vision. And this is also testing the sensory optic nerve number, or cranial nerve number two, which is the optic nerve. Okay, and then um, nerves three, four, and six are all both motor and sensory, and the they were tested using the six cardinal fields of gaze, and they are the oculomotor, trochlear, and abductans. Okay, and then cranial nerve number five is trigeminal, that is sensory and motor, and I would test it by asking Chris to close his eyes and then tell me if this feels even on both sides.
Yes.
It feel even in all three spots.
Yes.
Okay, and then so they were tested in the three distribution patterns, and then I would have Chris to clench his jaw. Can you clench your jaw? Okay, and that's cool. And then thank you. And then I could see that the motor portion of the nerve was correct intact. Three, four, six, seven. Facial. Um, Facial, I would have Chris, can you raise your eyebrows? And then, that's good. Can you crunch your eyes? Okay, that's good. And then can you smile? And then can you puff your cheeks? That's good. Thank you. And I can see that it's symmetrical and he had no difficulty with that, no weakness. And then, where are we? Seven, eight. Vestibulocochlear. I can tell that his hearing is grossly intact, and um, glottal and vagus 9 and 10. Um, I could see that his trachea is midline. He had no issues with swallowing. His uvula is visible. There's nothing abnormal about it. And then 11. Um, 11. Oh, can you shrug your shoulders for me? Thank you. And then push against my hand. And then on the other side. Thank you. And then I could tell. Oh, that was motor. Oh God, I gotta go through the other ones. We'll just keep moving. That one was motor. And then um, I think, and then 11 is acoustic. His hearing is grossly intact. That's sensory. And then 12 is hypoglossal, and I would have him stick out his tongue and then move from side to side. Thank you. And that is motor. Okay. And then I would have him to test his coordination and everything with his hands. Can you do your fingers to your nose like this? Thank you. And then looks good. And then I would have him to put his hands on his knees and go as fast as you can. Up, flip your hands as fast as you can until I say stop. Okay, stop. Okay. And then I can evaluate Chris's deep tendon reflexes. And I would do this on both sides for time's sake purposes. We'll do it on one side, but I would be doing this on both sides. And then I have my little hammer. I don't know where the hammer went, but I have a backup hammer. I have a backup hammer. Okay. And then I would locate Chris's. I'm gonna put the camera up more so that they can see my face and where I'm looking. Okay. Okay, and then maybe I could go here and then to evaluate deep tendon reflexes, I'll use on both sides, but I would do the brachial, and so and I would also feel his epitrochlear lymph nodes. I would have done that with my lymph node with my lymphatic assessment. Okay, and then I would with it assess the his brachial by relaxing his arm in my hand, and then I can find the brachial tendon, and then which is I don't know if they could see it's in here, and then with a little quick strike, I would um his arm would go up, and I don't know if the camera can see like his arm go up just a little bit. 2+ would be considered a normal. 4+ is hyperreflexia, which would indicate like a neurological issue, as would hyporeflexia, which is not enough. Reflexes that would also indicate some sort of neurological issue. So I've done that on both sides. And then, you would relax your arm in my hand, and then maybe we could move towards the camera a little bit, or like you can, like yes. And then I could actually straighten his arm a little bit and locate the tendon. Maybe if you put your back a little more to the camera, but have it relaxed and just like locate the tendon, which would be over here, and then just like a quick little strike. I would evaluate his triceps tendon reflex. Okay, can you sit down again? Thank you. And then I would evaluate his God, brachioradialis reflex by like his resting his arm right here. I'm not great at this, or it's not easy to see. And I wouldn't tell the patient that. I'm just telling you that. But I would strike the tendon that's right here, and I would expect his hand to supinate a little bit. And then also, so I'll put the can move the camera down a little bit so that they can see. I would do your um patellar, and I would be doing all this on both sides. And then he would have his leg relaxed, and then I would locate the patellar tendon, which I could actually do that by like straightening his leg and then looking like right there. And it's easier for me if I hit it with the part of the hammer, and then I would do like a little quick strike. Yeah, it did move. Okay. 2 plus reflexes, and I would have done on both sides. And then the Achilles reflex, I would like put his foot to a 90-degree angle, and I could start see his Achilles tendon on the back. I think I don't get credit unless they can see your Achilles tendon. Can you stand up and turn? And then maybe stand on one leg so they could see your there, and right there, that's the Achilles tendon. And I would expect his foot to go like that a little bit. And then, okay, you can sit down again. Thank you. Um, and then I can also test for vibration and sense and just like sensory. I would go like you have your eyes closed. Um, Tell me, can you, when you feel my touch?
I feel it.
Okay, do you feel it on both sides equally?
Yes.
Okay, tell me when you feel my touch.
Mm-hmm. Feel it.
Okay, thank you. And then I would take, for vibration, I would use my tuning fork, and I could, make it vibrate. And then I would test him on his thumb and have with his eyes closed and ask him if he could tell me when he feels the vibration and when he feels it stop. So tell me when you feel it start and stop.
I feel it. I don't feel
Okay, and then that's normal. And then I hit it again, and I would do him on the tip of his big toe. The vibration. Can you lift a little bit more? There. Okay. And then that's good. Thank you. And then I think that is it. Okay, I think that is it. Thank you.